Hey, this is Dr. Jason Saunders with HBOT USA. If you're watching this video, then on some level you're interested in starting to incorporate hyperbaric oxygen into your clinic, or perhaps you're looking into opening a hyperbaric center or a wellness center, starting to add hyperbarics into that process. And what I wanted to do is I wanted to offer you some of the frequently asked questions that I get with regard to what are some of the hurdles that people are experiencing when deciding to add hyperbaric into their offering, and hope to help you get over some of those hurdles so that you can see it's actually a very simple process. There are some rules and some guidelines that you're going to need to follow in order to make sure you're doing everything the right way. And I want to help smooth that process out as best as I can. I think the question I get the most is, should I get a hard chamber or should I get a soft chamber when I'm starting to implement hyperbarics into my clinic or if I'm opening a new center? So I do a lot of consulting work for a lot of different clinics all over the world, and there's no definitive or absolute straight answer to that question. And the reason is this: we know that soft chambers are great. People get tremendous value, patients get a lot of improvements, practitioners love soft chambers because they're a little bit easier to move around inside the office should your space change or you want to make some other changes to your clinic. They cost less. And so with a reduction in cost and with still being able to help a lot of patients, soft chambers certainly could meet the demand for most people. At the same time, within the profession, there is still this very strong optics to say that hard chamber hyperbarics is the best way to go. And it's the way that it's expected to be found inside a hyperbaric clinic. Does it have to be that way? Of course not. We ran soft chambers only for years before we started getting into anything else. And so is it possible to use soft chambers as your primary hyperbaric chamber in your clinic? Absolutely. Do you get more options if you're using a hard chamber? Yes. And so soft chambers have a very definitive cap to the amount of pressure that a patient can be exposed to inside of a soft chamber, whereas in a hard chamber, those pressure ranges can vary dramatically. And so if the goal was to open a hyperbaric center and to treat as many different patients with as many different issues as possible, if you wanted to customize the protocol to basically create very individualized sessions and following the research, you wanted to make sure that you were using the most well-researched pressure for this particular indication, then a hard chamber will be your best bet. If you understand that hyperbaric is really just delivering oxygen as a nutrient, the way we teach it, in higher levels than what we're able to get under normal atmospheric pressure. And so when we raise atmospheric pressure and we raise the percentage of oxygen, we're now delivering higher levels of oxygen than what anyone's able to get under normal circumstances. And regardless of how much somebody's getting, we are still creating this reservoir that's still going to improve healing. It's still going to improve tissue regeneration, cognition. It's still going to create an improved healing response inside that patient. Then you also understand that soft chambers are very capable of doing that. And so if you have flexibility with regard to how much pressure you're able to give somebody, and you understand that there are certain conditions or certain indications that you really ought to refer out to for hard chamber in certain circumstances, particularly on label circumstances like for wound care or certain infections that you're trying to treat, then you can still service the majority of the population coming in using a soft chamber. Obviously, soft chambers have lower costs associated with getting into the hyperbaric field. The equipment costs less. There's less of a build-out requirement needed. And so that might be an easier entry for somebody. Hard chambers, the equipment costs more. And in certain cases, there are build-outs that are required to make sure that you meet all the NFPA guidelines associated with your clinic. But if you don't mind those costs, obviously with that, you're going to get a more varied opportunity to treat different conditions in very specific ways. The next most common question we get is, what types of patients respond the best to hyperbaric? So again, the answer to that question can vary. But here's what I'll tell you. I'll tell you that hyperbaric has been associated with helping to heal certain conditions. That being true, I like to steer people away from thinking about it from a treatment for disease standpoint. And I like to steer people into thinking about it as an ingredient necessary for healing and regeneration, understanding the mechanisms of action. In all of our courses, we talk about mechanisms of action almost ad nauseum because it's so important to understand that, so that you can apply hyperbaric properly depending on who's coming in and what they're coming in for, what their goals are. That being said, one of the things that hyperbaric almost gets a bad name for is being this cure-all. How could one tool help so many people with so many different conditions? And again, that's why I steer away from the curing or the treatment of illness versus the application of mechanisms of action, because it is not a cure-all. It is simply a tool to use that dramatically affects the inflammatory response and the healing response. And when we understand that, then we can understand why it has the ability to help so many conditions. It's not that it's helping those conditions specifically, it's that it's providing the ingredients necessary for that person's body to heal itself. So what kind of patients really respond well? I would say this: neurologic conditions and immunologic conditions are some of the things that respond the fastest. Neurologic conditions like TBI and concussion, post-stroke recovery, MS, neurodegenerative diseases, especially dementia, but also Parkinson's, and then neuropathies, whether that's a traumatic neuropathy or a chemical neuropathy caused by, let's say, radiation or chemo, but neuropathies respond really quickly to hyperbaric oxygen. When I say immunologic, that could mean autoimmune diseases. So again, MS being one of those, but also the whole range of autoimmunity, folks that have RA or lupus, also patients with Hashimoto's or Crohn's and colitis. These people do really well. Again, not because we're treating those diseases, but hyperbaric has this way of reducing the inflammatory response and then regenerating a healing response so that these tissues can actually start to heal in the absence of that inflammatory response. So these are the people that do the best. We also use it for patients that have autism, patients that have musculoskeletal sprains and strains, patients that have POTS or other autonomic dysfunction. And so a lot of patients can respond very favorably, but I would say the neurologic cases and the immunologic cases are some of the folks that respond the fastest. Also, along the immunological side, this post-COVID recovery, this long haul syndrome, also these patients are responding very well. Currently, we're treating a lot of those folks. Relative to patients who come in with a lot longer standing chronic issues, these folks are responding actually pretty quickly. The next most logical question is, if I'm going to incorporate hyperbaric oxygen into my clinic, how long are the sessions, how are they booked, and how many sessions do people really need? So also the answer to this question depends. What is the severity and chronicity of the issues that we're talking about? Patients that have more severe issues or goals that are going to be a little bit harder to achieve, patients that have had these conditions for many, many years, it takes longer, just like anything else in medicine. Those patients, it's going to take longer, it's going to take more sessions. Patients that have less severe issues and or things that have affected their bodies shorter periods of time, obviously those folks tend to respond faster. General guidelines would be that most sessions are between 60 to 90 minutes. We book 60-minute sessions at about 70 minutes in our schedule. We book 90-minute sessions at about 100 minutes in our schedule, just to allow for the time of pressurizing, depressurizing, and changing over the equipment. In terms of frequency, we're looking at, a very aggressive protocol for somebody might be, 4 to 6 hours a week. A less aggressive frequency would look something like 1 to 3 hours a week, again, depending on the severity of what we're trying to accomplish. Duration, how many sessions over time? More severe, we're looking at upwards of maybe 30 to 40 hours over the course of 8 to 10 weeks. Less severe, we're looking at somewhere between usually 10 to 20 hours in somewhere between 3 to 6 weeks. Again, we help formulate a lot of these thought processes with regard to protocol in all the trainings that we do, so that we can take a process of understanding those mechanisms and then applying them to when we expect to see what types of changes over what period of time, depending, of course, on which equipment you choose to purchase and operate inside your clinic. The next most logical question that's probably running through your mind right now is, once I choose which equipment I have, I'm starting to operate and run, what should I expect in terms of charges for how much does this cost a patient in order to be able to receive this type of therapy? After nearly 20 years of practicing hyperbaric medicine in my own clinics, and now having the opportunity to train and certify over 600 different individuals, technicians, and clinicians inside of over 300 clinics worldwide, I've gotten a really great idea of what works and what does not work when it comes to launching a hyperbaric business. Over the last 6+ years, I've had the opportunity to consult with and continue to consult with offices and clinics that are opening a hyperbaric business to get this process started the right way. I've now also taken the first few months of that consulting process and distilled it down into a very concise course, essentially a quick start guide of how to roll out hyperbarics inside of a new clinic. The content from this video is a small portion of what comes inside that quick start guide. If this information resonates with you and you're interested in the quick start guide or the consulting services, we will leave links in the description below and you can check that out. With regard to patient cost, part of the answer of this will be determined by which equipment you're running, soft versus hard chamber, and what type of oxygen you're running, concentrators versus, liquid oxygen or bottled oxygen, because you're going to have different costs associated with these different pieces of equipment. But just to give you an idea, in general, the rates for soft chamber tend to be lower than the rates for hard chamber. It makes sense. It's a lower operating cost. It's a lower equipment cost. And so the patient cost ends up also being a little bit lower versus hard chambers with other oxygen sources. Again, it's going to cost you more to get that rolling. And so the patient costs also tend to be a little bit higher because the operating costs are a little bit higher. Having the opportunity to, travel all over the country and really all over the world and consult with lots of different clinics in different areas, I get to see ranges of fees that different clinics are charging. What I would say is on the soft chamber side, the range of fees tends to be somewhere between $85 to $90 per hour on the lower end and up to about $150 per hour on the higher end for the soft chamber. Now that's typically the single session rate, and we often help clinics to create packages because ultimately very few patients are coming in for 1 or 2 or 3 sessions. Most patients are nearly needing to come in for a series of therapy. And so because of that, we should have one rate that is your single session rate, and then subsequent rates that are really based on packages and usage. As a patient is committing to their process of healing, we can give them a discount for that commitment. And so those ranges are going to be somewhere, again, between 85 to 90 up to about 150. On the hard-sided chambers, those rates tend to be higher. I would say on the absolute lowest end would be somewhere around $150 to $160 an hour, all the way up to $375 or even in some cases more. And so the range on the hard chamber is much, much more varied. And those prices are really talking about off-label clinics. In other words, clinics that are predominantly treating insurance-based conditions, pretty much hospitals or wound care centers. I mean, those rates could be upwards of, $500, $700, all the way up to $2,000 an hour. So this is a freestanding, hard-sided chamber clinic that is really focused on off-label treatments only, predominantly like what we do in our clinics or in the clinics that we train and or consult with. And so those ranges are going to be closer to that 150 to 160 all the way up to 375. I would say the average is somewhere between 2 to 250 per hour. And again, that's for a single session. Packages, we can start creating some packages and creating some discounts based on package size. When considering bringing hyperbaric into your clinic, you also have to recognize that the business model with regard to, the return of investment, you're putting money into your training, your implementation, your equipment, potentially a build out. And so you really expect that if I'm going to invest into my clinic in order to get better results for my patients, that there should be this return of investment on that process, which of course there should be. When thinking this through, what you should understand is you're going to be paying a technician to operate the equipment as well. The ranges of pay for that technician could be anywhere, depending again on where you live, maybe on the lower end, $18 an hour, on the high end up to maybe $25 to $30 an hour. But recognize this, a single technician could operate a single chamber, but a single technician can also operate 2 chambers, 3 chambers, and then they're really well trained and you stagger appointments properly, even up to 4 chambers. I bring that to your attention because when you're considering bringing this therapy in, some of these numbers, they still make sense when we talk about a single chamber inside of an office, but they really start to make more sense when we're looking at 2 chambers or 3 chambers or more. And so oftentimes when I'm consulting with a practice, I recommend starting with 2 chambers as the starting ground for how to operate, even if it meant you had to lower your hours to consolidate the timing of treatments, but then you're still having your technician operating at least 2 chambers simultaneously. And that could become very beneficial as far as, managing time and expenses. As the clinic and the patient volume starts to grow, you can start to expand your hours and then potentially even implement more chambers if it's appropriate. But you want to think about all of those pieces when you're trying to decide, which equipment, how much, how often, what are our hours, et cetera. The next most common question is, it sounds great. I'm really interested. I'm looking for new tools to add to my clinic, new tools to add value into what we're offering patients. Hyperbaric is really high on my list of something I really want to learn more about so that I can offer it to my patient base and or bring new patients into my clinic for hyperbaric. But what are my next steps? So watching this video is really step one. Understanding that there's different types of equipment, understanding that different types of equipment have the ability to help different types of patients, and starting to formulate in your mind what types of people are you already seeing or what types of people are you hoping to see. Based on that, which types of equipment should I be running? Based on that, what types of fees should I be thinking about are associated with the treatments that you're offering? A lot of the work that I do, especially over the last 3 to 5 years, has been building the education necessary for operating a clinic like this, building business strategies around operating equipment like this within an existing clinic, or opening a new clinic to just offer hyperbarics by itself, or a wellness clinic that offers, multiple modalities. And so, when I first started teaching these courses, I would say that the majority of people were people already in business, already operating this equipment, and they were just looking for the sources of information to have better protocols, to be able to talk about hyperbaric more effectively, to try to express what hyperbaric is doing, both to patients and other healthcare practitioners. But now the majority of people that end up in my courses are really people that are first looking at, should I be getting into this? And they come to our course first. This one gets them certified in hyperbarics. So by the time they get their equipment, they're already hitting the ground running. They know how to talk about it. They know how to explain it. They know how to have meaningful conversations with patients as well as other healthcare providers about why hyperbaric is so important, how hyperbaric works. At the same time, they already have all the information they need with regard to how to build effective protocols and how to start the process of building the business. And so now more than ever, our classes are being filled with people just like you who are thinking about getting into hyperbaric, but really want the education before they jump in. That's going to give you all the information and all the details to all those other questions that we were just talking about with regard to what's the best equipment and who you should be trying to target and how you can start building the processes and procedures inside your office. Beyond that, your next steps will be actually making those decisions. And oftentimes, I might get hired by a group that's starting this process to help guide them onto which equipment they should be choosing and how to start training their staff, how to hire their technicians and then train their technicians for operating the equipment, et cetera. And so you're on the right track. This shouldn't be a decision that's just made on a whim. It's really important that you consider all of these different avenues before making a decision like this. And taking part in some of our education courses will really give you enough information to feel very confident that, yes, this is the direction that you want to go. And within that, here's the very specific path you need to follow in order to be able to operate effectively and operate your clinic safely. And that's what this is all about. It's about adding value to patients, helping patients in a very unique and specific way that ultimately nothing else can do, but doing it safely and doing it effectively. And ultimately, that's what I hope you get from the different levels of education that we offer. So I appreciate your time and attention, and I hope you found this video helpful. If you're the type of person that just needs to answer a few of these high-level questions and you're ready to roll, then hopefully this content gave you the answers that you were looking for, and you can just start choosing the equipment that you want and start running with that, and that would be great. For those of you that feel like, I appreciate the information, I could really use a little bit more support along the way, I want to say this. Number one, we offer consultations where we can just have a few phone calls and go over some of this content in more detail and then set you off, running on your own. We also offer multitude of different courses. So we have our basic hyperbaric technician course, which is an online course. We have our intermediate hyperbaric technician, which is really an in-person immersion course in hyperbaric oxygen for technicians. At the same time that we teach the intermediate hyperbaric technician, we also teach the functional medicine hyperbaric clinician course. And so clinicians and technicians come to that in-person immersion to really learn all that there is to learn virtually on hyperbaric oxygen. I wrote that curriculum based on 17 years in the field, running chambers and building this business. And so I literally try to teach you as much of the 17 years of experience that I have, and the feedback that we get on those courses is really tremendous. And I'm sure that that will answer virtually every other question you could possibly have as far as the science of hyperbaric, how to communicate about hyperbaric, and protocols about hyperbaric. Lastly, we also have a business consulting program. And so outside of the science and the protocols, there's the operations of the business itself. What should you be charging? How do you market this properly? What are the policies and procedures in your clinic? What does the research tell us about hyperbarics? What sort of safety processes and procedures do you need to have in your clinic? How do you document your visits? All of the things that go into the business aspect itself. We have a full all access business building program that we offer, which is also predominantly online. And so depending on where you sit in those different phases, please feel free to contact us, ask us questions, or choose one of those roads to help you continue your journey and getting you ready to really build and operate the hyperbaric clinic that you were hoping for. Thanks again for your time and attention, and I look forward to working with you and helping you down that journey.